Hi there and welcome to my demonstration video on the manual therapy technique reflex inhibition. There's not much evidence on reflex inhibition in horses, though Wakeling et al. Does suggest that it's good for reducing muscular pain in the longissimus dorsi in horses with back pain. And it's also suggested for use by Kumar et al. And Sharp 2008. So the indications for use are there for muscular back pain, especially along the impaxials. Whereas the precautions and contraindications would be contraindications being malignancy, tumours, fractures because of the contraction in the area you have to cause, open wounds especially, and acute scars. And precautions I'd say would be just be careful of the young or nervous horse, as it can be quite a noisy and sudden technique which can make them quite scared. Today I'm using Bella. She's my hunter and I know her really well, but I will still be looking out for any behavioural responses or pain responses as I do it and adapt my handling as needed. I don't have a handler today, she's tied up due to COVID-19, and plus I know Bella really well. I know that she's quite happy being tied up, but she's tied up loosely, so for safety reasons if I did need to release her I could. So yeah, do you want to come around the other side and I'll show you the technique? Reflex inhibition works is first you need to find the point of pain along the longissimus dorsi. To do that you start at the withers, you work cranially to caudally, and you start at the DSPs and just run down the muscle belly, and you're feeling for points of tension or pain. I've palpated Bella a few times, so I know actually there isn't any points of pain down her back, so for demonstration purposes we'll say here's the pain. So you come onto the other side, so onto the agonist muscle, because the way it works is you apply a contraction to the agonist muscle, so the side that you work on, to cause a involuntary relaxation on the antagonist muscle, so on the contralateral side, by the myotatic reflex. So as I said, we'll treat this side, so apply pressure with my thumb. There's lots of ways you can do reflex inhibition, there's no real right or wrong. It's how your handling works for you to get the wanted contraction. So I apply pressure with my thumb, I then tap and then apply a more deeper blow. So what I do is apply the thumb, and then you can see the contraction on the muscle which has the involuntary relaxation on the other side. So you can do it multiple times, working down. But the best thing to do is make sure you keep coming back up to the withers, starting cranially, working caudally, and checking that you've cleared the area before you move caudally. So whilst you're doing it, you're looking for the contraction on your side, checking with the horse that there's no adverse behaviour. Bella was very relaxed, so I was happy to do a few treatments along the way. And then afterwards, you should feel that the tension, if it was there, has released, or the pain response or fasciculation has either lessened or gone. If it hasn't, it's okay, you just come more cranially and you do the reflex inhibition again until you clear the area and move on. You can also end it with a nice spinal reflex stretch, which is really nice to elongate the muscle even more. And that's reflex inhibition. Hi there and welcome to my video demonstration of the manual therapy technique mobilizations. I'm going to do an accessory joint mobilization at Mustard's glenohumeral joint today, in line with Maitland's 1991 theory of joint mobilizations. Maitland 1991 describes 4 main joint mobilizations, the 5th being a manipulation. So grades 1 and 2 are aimed at reducing joint pain. So grades 1 are small amplitude, not into resistance. Grades 2 are slightly larger amplitude, again not into resistance. Whereas grade 3 and 4 are aimed at increasing joint range of movement. Today I'm going to demonstrate a grade 1, so aiming at reducing joint pain. I'm going to use Mustard today. She's my dog. She's purely a pet, she's not a working dog, and I know her really well. So I don't have a handler, A, because I know her well, B, because of COVID, and C, Mustard's very distractible, so any extra people in the room would mean that she would just want to play. She's in lateral recumbrancy, so it's the best position for me to access the glenohumeral joint, and I've got my leg just rested over her. Now I'm not compressing her or restricting her, she's free to move, but she's a dog that likes touch, so she finds it quite comforting. I can see her face and her body language from this position as well, so I'll be kind of governed by how she responds with regards to my handling and the technique. Now, Kumar et al. 2012 suggests that joint mobilisations are good at reducing pain because they block the nociceptive pathways by causing an inhibitory effect and therefore reducing pain. Kumar et al. And Maitland also suggest that joint mobilisation should be done at around 2 Hertz, which is for up to 30 seconds to a minute. However, in real time, it kind of all depends on your dog's tolerance and how they tolerate it. So before we start, indications for use would be, as we briefly discussed, joint pain, joint range of movement, so kind of the likes of your osteoarthritic joints. Contraindications and precautions. So contraindications would be malignancy, fractures, recurrent luxations of the joints. If you've got an unstable joint, you're not going to be mobilising it. Open wounds, because you do need a firm but comfortable pressure on the skin around the area. And precautions would kind of be your behaviour of your dog. So if they're unwilling to lie into lateral recumbency for the likes of the glenohumeral joint, or they're quite a worried dog, then it's probably not the best technique to use. So yeah, I'm going to demonstrate a grade 1 mobilisation. So to do that, I'm going to fix her scapula. Good girl. And then I'm going to gather up the skin and the hair. Quite important in a dog to make sure you're getting a firm but comfortable grip on the humerus underneath, and that you're not, when you're distracting, pulling down on the soft tissues. I'm also going to bring the thoracic limb into a neutral position, so I'm getting true distraction at the glenohumeral joint. So fix the scapula, good girl. And I'm gently just drawing the humerus down. Very gentle oscillations. So whilst you're doing this, because it's aimed at reducing pain and therefore not into resistance, you shouldn't feel any resistance within the joint. It should be nice, soft and springy, because you're not getting to that point of resistance. And Mustard, as you can see, is tolerating it quite well. She's not showing any kind of aggressive behaviour or worrying signs. So as Kumar et al. Suggests, up to 30 seconds to a minute, or depending on the tolerance of the dog. Post-treatment, you should notice a reduced pain within the joint, so the dog should feel more comfortable, and therefore that could have a carryover effect of increased range of movement due to reduced pain and guarding. Perfect. Thank you for listening.